Hi, I'm Kathy Fricke. I live in Flemington, New Jersey, and I had anal cancer 5 years ago, and today I'm doing great. I was just feeling fine. I was 60 years old. I had been to Chicago to a wedding, and then I'd gone to Sun Valley, Idaho to visit my sister for a week, been on a hike, and one night I kind of felt down near between my legs an area that felt like something that was throbbing. And I thought, that's really strange. A couple of days later, I told my husband, I had some rectal bleeding. I think maybe I should see the doctor. So that was when I came to see my primary doctor at Huntington Medical Center. 2 days later, I went. She immediately said, you need to go to the gynecologist as a first step. I got right in. And after a series of going to the gynecologist and the gastroenterologist, I did get a colonoscopy scheduled. They found a mass. They said it's probably cancer, we don't know. And when it came back, they said it was anal cancer stage 2 was the good news, which is that it hadn't spread, but it was about a 3.5 millimeter tumor, and that I needed to go to the cancer center. So once I knew what I needed to do, I called the cancer center and they said, when can you come in? And I said, I can come in the minute you can get me in. They said, come in tomorrow morning at 9 o'clock. I was met by a nurse navigator. She was fantastic. She started to explain how the process worked. Well, when I first came to the cancer center, I had a good feeling. I felt, but because I had been met by a nurse navigator that basically said, I'm here, I'm gonna walk, my job, as well as other nurse navigators, is to walk you through anything you have, any questions you have. Everybody seemed to be incredibly supportive, explaining what was going on, and I think I absorbed as much as I could, because you're kind of in shock at first when you hear that you have cancer. But as time went on, it became more and more evident that there were a whole lot of players that came into play. Everybody from a nutritionist to the palliative care to social workers to the chaplain. It was really a full service hospital and it wasn't just, I didn't have to wait for the hematologist or the radiologist to recommend somebody. It might be the nurse in the chemo center could say, well, why don't you try this? This seems to help people. Or why don't you try that? That seems to help. So I think the biggest thing I can say to people is to be open about your symptoms, be open about how you're feeling about things, ask questions, but don't be afraid to ask for help. Don't be afraid to say, gosh, I'm really feeling sick. Do you think somebody can help me with this?
I felt that from the first diagnosis, Kathy really benefited from the integrated systems approach to it, starting with the nurse navigator and the fact that we could develop such a close relationship, closer than we ever thought we'd have, with her oncologists and the affiliated services for that. And it was just a really a good relationship for a really rough time in our life. I really felt quite close to them because as a caregiver and as a family member, the patient's care becomes your whole world. They were people who knew me and more importantly knew everything about my wife.
So I started radiation and chemo at the same time, and from day one I was pretty sick. When I went in to get chemo, they have what they call the sunroom, and you sit in your half circle, which I'm sure people have seen. And one nurse in particular, Carl knew, my husband, Chris Salerno, but all the nurses took great special care, but she always made me feel like I was really special. And you sit there, and then the partners in caring, some people that had had cancer, they would come in, do you want anything? Well, I was feeling so crummy, I didn't want anything. But just the fact that people would take their time to be there and ask you if you want cranberry juice or crackers or something. But to sit in this half circle, and then they had all these thousands of cranes down that people had made for healing, it just gave you a feeling that you were in this together. So that kind of support was huge. I think just going through the treatment before I got in the hospital, that was incredible. And then it was about 2.5, 3 weeks into the treatment, Lori, who was the nutritionist, knew I wasn't able to eat hardly at all. And then she talked, and I had a lot of nausea, I had a lot of pain. I was getting Oxycontin and Percocet and lots of things for the pain, lots of things for the nausea. And she says, why don't you go to palliative care? And I said, And I had been a hospice volunteer for 5 years, so I knew about hospice care. I didn't really know about palliative care, and they had just started it here at the hospital. So I said, well, what is it? She goes, well, they just deal with your symptoms. Well, believe it or not, I felt like one of those school kids that's like, I don't want to get my teacher mad at me. And I didn't want my doctors upset that I went to palliative care. And at that time, 5 years ago, palliative care was a brand new thing. And I thought, I don't know. So I didn't. So, and that's even as an adult that's been a teacher that understands why I didn't go. So then the next week she says, have you gone to palliative care? And I said, she kind of shamed me into it. And I said, no. She goes, how are you feeling? I said, I am so nauseous, sometimes I can't stand it. She goes, I think you need to go. They can really help you. Okay, so I called up, went the next day. Colleen Bell was the nurse practitioner that I saw. She spent 1 full hour with me talking about symptoms, things that you would never even talk to your best friend about. But, you know, she says, I have to know every single thing so I can help you. And after that, the symptoms began to get really good under control. And so that was a huge piece of getting through the treatments. And I didn't know at the time, but the kind of cancer I had, in order to cure it, which is basically kill the cancer cells, you have to have enough radiation that the tumor is basically eradicated. And you have to live through those treatments. And by going to palliative, I think it really helped me continue to get through those treatments, because I basically came to the hospital, did my treatment, went home, and laid on the couch and basically slept. Before the treatment started, they said the treatment for your type of cancer is pretty rough because it's radiation on an area of your body that is very sensitive. And so there's a lot of side effects. So what we're going to do is take you to the edge, but don't worry, you know, we're just going to take you to the edge, but we'll bring you back. You're going to be fine. When it was all finished and I went back to see Dr. Greenberg, I said to him, you saved my life. For that, I will always love you. And I said, so I have to thank you for saving my life. And he looked at me, and Dr. Greenberg is a pretty serious guy, and he goes, well, that's a lot of words for one sentence. I don't think I've ever heard all that in one sentence before. I think I need to give you a hug. And, you know, that's just, that kind of sums up a lot of what this place was about.
The decision of where you have care, I think it really depends upon the staging and the type of cancer which you have. The Hunterdon Health System is affiliated with an NCI, which is Fox Chase. We knew that we would have access to really good implementation of a plan. Being able to be 10 minutes away instead of having to be either 40 minutes away or 2 hours away when you have to go somewhere daily, it made it a pretty easy decision for us to stay close. The fact that, you know, Kathy was able to complete the whole treatment for the type of cancer that she had and then eventually recover was really a wish come true. She was able to see the wedding of her daughter, the birth of her first grandchild. We've been able to travel in Europe and Asia. She even did ice climbing in Patagonia and went to climb temples in Angkor Wat, Cambodia. I mean, but if she hadn't been able to get through the process, you know, she wouldn't be alive. So we're, you know, completely grateful to this health system.